So, hello everyone. This is Lisa Presley again with your March Tuesday evening President's Webinar Series. And to begin tonight, I want to read this. Our readings tonight are from the book Poems to Live By in Uncertain Times, which came out in 2001, and it just seemed like a good book to also pull off my shelf today. And so this is one of my favorite readings by Wendell Berry called The Peace of Wild Things. When despair for the world grows in me, and I wake in the night at the least sound, in fear of what my life and my children's lives may be, I go and lie down where the wood drake rests in his beauty on the water and the great heron feeds. I come into the peace of wild things who do not tax their lives with forethought of grief. I come into the presence of still water, and I feel above me the day blind stars waiting with their light. For a time, I rest in the grace of the world and am free. So, welcome to you and to those who may be viewing this recording afterwards. As I said in my email that I sent last week, and it seemed like a something that was ahead of the curve that I didn't really need to do yet, um, was tonight we're going to be talking about the coronavirus and COVID-19 and congregational safety and how you can do things in that. But it when I sent that email out last week, it seemed like, okay, well, maybe we need to do this. And the speed of what's been happening has picked up so quickly that today alone, I was in 3 hours of staff meetings around how do we deal with the coronavirus? What do we recommend to congregations and the like? So, the first thing I want to just say is I am not a medical professional. I do not have details, and I don't think that we will have that many details for a while because this is still too new. However, what I can help you do is wrestle the uh, with the anxiety and uncertainty that happens in your congregations and help you figure out what are the questions we need to answer and how do we make the kinds of decisions we're going to do. Um, so I have a number of resources, but I just am also willing just to have conversation and take your questions, etc. At one point today, when I was talking with someone, I said, well, some of our congregations have a hard time even deciding whether or not to close for snow and ice. How are they going to make these kinds of decisions? And my wisdom, what it is to advise you to, first of all, breathe deeply, to realize that you are not alone, that there are many, many other people who are going through all of this, that none of us know, and all we can do is do what is best for the time being, and that might be different the next day, and we might realize months from now we should have done something else. But if we can lead from our best knowledge and resources, that's always good. I also am among those who encourage a deep abundance of caution. One of the things that I realize is that I am more likely to be a carrier of this illness to other people than I would be to really be um, gravely gravely impacted by it myself, because I don't really have any of those underlying conditions that are there. And so my responsibility then, I see, is to help make sure that the communities in which I work and move and all of that kind of thing are are protected from what I may be bringing into them. Um, and so that that abundance of caution, I think we should assume that in every gathering we're in, there's at least one person who has been impacted already by the coronavirus. It might vary a bit depending on where you are. I know that in Michigan, as of today, they have no confirmed cases, but they've only tested about 400 people. And only, no, they've, I think they've there's about 400 people who are being watched, but there's only about 100 who have been tested, and they only have the results back from 2/3 of those. So, who knows? And with the lack of availability of the tests, and the only recent change of, there was the criteria you had to have been traveling out of the country. I I don't think we really can know for quite some time how widely this is spread. Um, the UUA on Monday came out with an announcement that all staff who are based in the Boston office should start working from home as soon as possible. Because there are enough cases in the Boston area, Harvard University is telling students not to return from spring break. So it's widespread. There are various areas in our country where it is much more widespread than that. So what it means is that we have to be cautious, but we don't have to panic. Um, and um, and so I have a whole bunch of resources I can share with you tonight just to show you, there. And I'll be sending out a list with the links to all of these too. So don't feel you have to madly uh, copy them down. But I just wonder, where are you in your congregations now? Have you started having the conversations? What are your concerns and that? So Amy, I see you unmuted.
Yeah, I did. We're having these conversations a lot right now, and we're grappling with like what kind of policies we need to have in place. And we are specifically looking at, well, I'm specifically looking at like, how do we decide who makes this decision? And what kind of policy do we make around that? And also, um, I don't know. I don't know what I don't know, and I don't know what kind of policies we need to have in place from a financial aspect around these kind of events that happen. I mean, certainly our employees have sick time and paid time off and that kind of thing, but I don't really know what I don't know about that right now. So we have a big board meeting tomorrow so we can discuss it further. And we have, I've talked with our interim minister, Reverend Diane, and we actually are throwing out ideas like to do a modified service for Sunday where we don't have programs and we don't serve food and we don't have baskets that we pass, but we just kind of keep it low key. And then we're preparing ourselves to be able to do services online. So we're starting to see what we might need to do if we were to close, and just looking at if we need to close, because certainly the majority of our population is over the age of 60. That's kind of where we're at.
Thanks, Amy. Wendy, what about you? Oh, Wendy is asking where you're from, and the answer is Coralville, Iowa. So outside Iowa City.
Oh, well, I think I'm on mute.
Yep.
Oh,
Go for it.
You can hear me, right?
Yes.
Well, we have, I think, 63 is the youngest person in my congregation. Now, mind you, we only have 32 members. For me, it's a real concern, especially with the aging population. One of the nursing homes, we do a service once a month, just a small little thing in a memory care unit out by us. And they actually called me the other day to say, if you're going to send anybody, just send one person. We're locking down. I think this is a conversation we have to have in our church because I'm very concerned about the elderly populace. One of these people gets ill and they're already compromised, So we haven't done a damn thing, to be blunt. And I'm thinking we have a board meeting on Friday. So I'm thinking maybe I need to talk about that. Sorry about the thought. But so that's where we're at, basically doing nothing.
Thanks. Bev or Judy, do you want to chime in and talk about where your congregation is in the conversation at this point?
Hi, Lisa.
Hi, Judy.
I don't know where we are, so.
That's good enough answer. Okay.
I'm on vacation, so this is usually I have class on Tuesday night, but it's spring break, so I was able to join you tonight. But I will find out more when I get back this weekend.
Great. Thank you, Judy. Bev, I don't know if you want to share. If you muted through the Zoom system, it's *6 to unmute.
Oh, okay. Thank you, Lisa. I had a really hard time getting signed in tonight,
Yeah.
so I'm using my phone audio, and then I can't seem to turn the video on. I guess we've I just have been thinking about it a lot, and I started the conversation over email with the board, and then I've made several phone calls to various leaders in the congregation. It's become apparent to me in the last few weeks, we have this ritual that we do at the end of our service, kind of at the benediction, where we ask people to hold hands. And for many, well, all winter long, we've been saying, you know, you don't have to hold hands, you can lock arms or do other things. But what's interesting, and I tried an experiment, was I tried to just, you know, hold my arms up for people to lock arms with me. And people grabbed my hands and took them. So I'm like, okay, we got to do something about this, you know, because it's not, there's like this group pressure to hold hands, you know. And so I'm, and our minister is on sabbatical right now. So it just seems a little bit complicated, but what I'm recommending is that we form kind of an ad hoc task force to look at kind of like immediately things we should be doing and how we should be responding based on what our public health officials are telling us. And then also kind of like a second layer of things, looking at policy. We do have a cancellation policy for events. I think we need some folks to take a look at that and see if it's adequate, you know, for the situation we're in right now. Because we actually, we made the policy after.
Yep, Bev, you just muted yourself again. Let me see if I can unmute you.
Okay, am I unmuted now?
Yeah, you are.
Okay, I don't know how I muted myself. Anyways, so we have to look at the policies that we have, whether they're adequate. The other thing is that I also look through the building and we have very little hand sanitizer. We have no supply of it, and I've checked around in town and you can't really buy it. So I got a recipe, and we're going to try and make some up and refill the dispensers we have with that. And that's kind of our initial phase, is to change the ritual and make sure we have hand sanitizer available. And then maybe a town hall meeting or two to hear from people how what their concerns are and how to move forward.
Right. And so one of the things I'm aware of is that our congregation in Kirkland, Washington is the one where the nursing home is, or the care center where so many people were. I'm just going to mute you, Bev, for a while. So
thank you.
They decided with very smart sense. I mean, you know, you've heard that there are probably 70 staff members of that care center who they believe are, they decided to cancel all in-person events at their congregation. They ordinarily have an attendance of 90 people at their worship. They had 84 people join them online for the virtual. So my sense is that, you know, so what this is forcing us to do is to think in new and clever and creative ways. How are we going to create community, reach out to community? You know, yes, how are we going to make the decisions? Who gets to make that decision? My thought is that it's a combination of the board and whatever religious professionals you have. That you look at what are the guidelines that your health departments are making. You know, how do you decide to do this? What are other organizations in your community doing? Are they restricting gatherings? Many states now are under a state of emergency declared by the governors, and so paying attention to that. This is not something to muck around with. Let me show. I'm going to share a couple of things here. And as I said, I'm going to be sending out links to all of these things. And one of them here I find really compelling. Can you see that graph? Um, this is talking about the whole thing about flattening the curve. That if we don't start doing things like social distancing, which means being away from people and doing the washing the hands and all that kind of stuff. What it shows here is that if we don't do that, there's going to be a large number of cases that happen right away, and it will overwhelm our healthcare capacity. We won't be able to deal with that. However, if people start doing things like social distancing and following all the advice, then what will happen is there may be more cases but spread out over more time. But that allows our healthcare system to be able to have the resources. You know, if you're under this red curve here, and you need a respirator, they might not have enough respirators around if you're one of the people who's very greatly endangered. But if we can delay the onset, it allows both spreading out so that we still have enough resources, but also it allows more time to understand how is this really transmitted, who is in danger, how do we treat it, and all that kind of thing. But what I also found compelling in this article was, as I scroll down here, what is the mortality rate by age? So although they're saying it might be 1%, et cetera, what we've so far looked, and this is the Chinese Center for Disease Control, is that in our congregations, it's going to be much more than 1% if people get this. And I think that showing these kinds of documents to our people and helping them understand that this is not your ordinary flu, this is not the ordinary thing, and that what we're required to do is really pay attention to who are we trying to protect? I mean, the good news is kids are not impacted in this one, but then but what that means is that sometimes adults will sort of poo-poo the whole notion. Um, there are a whole bunch of resources that are out there, and I'm just sort of going to start flipping through my page. So that's how do you do that? And then the financial aspect. If you're worried about people donating to you, there are lots of online things. You can always set up a PayPal account to get that. One of my concerns is, what about the people in our congregations and communities who are hourly, who don't have paid time off, who with their business closing or some things happening, they may or may not have work. So when the UUA announced this week that they want us to work from home as soon as possible, and that was pretty funny to those of us who never work in the office and always work from home. One of the questions I had was to reach out to make sure that the UUA was doing the right thing, and they are, which is that our hourly people who work in the building, our cleaning staff and all of that, are going to get paid regardless of whether or not they show up on the job. They don't have work they can take home to do. But I wonder then, so how can our congregations help members who might have financial losses because of this, and how can we help in our community? So one of the newest resources that came up is yesterday, one of my colleagues who was on the Safe Congregations team put up this section of our UUA website. And I'm going to send you the link, but the short form is uua.org safe/pandemics plural. And it talks about how do we do church, and how do we adapt worship on Sunday, and how do we continue to gather in small groups. With links to various things. So the emergency operations planning one helps you get to the statement that our president, Susan Frederick came out about what do we do? How do we figure out some of the things to pay attention to. How do we care for each other, etc. So those kinds of things are there. What's also happening is a number of things are popping up. But anyway, this talks about, adapting Sunday morning and small group meetings. How do we do our care networks? One of the other things that popped up is that within our religious educator and minister cohort, they have created this Facebook group called UU Religious Professional Response COVID-19. Now, it's a group anyone can search for, but you have to ask to join, and it really is only for religious professionals. Again, this link will be in the resource page I sent out. But what they're doing too is they're sharing how are we doing this? What's going on? There are some documents about hymn copyright, because that's another thing you have to do, faith-based community checklists and various things like that. So if you're in a congregation with religious professionals, you can use this as a thing. And they've created also this shared drive, which is a lot of information around how do we the Zoom and Facebook notes. How do you do this? One of the things that people are doing now for live streaming of events and making that decision, one of the things that you can do is Facebook has a live feature where you can use that. I'm not the tech person who knows how to do that, but there's also Zoom, which is, I think, $15 a month, so you can always just buy an account, and you have to buy it for 20 years, kind of thing, like with some other things, and you can do that. The UUA is working on, and should have out sometime this week, a list of how do you do tips for doing worship online, and how do you do that kind of thing. One of the things that you can do with a Zoom account is you can do breakout groups. So you could always have little check-ins by, divide them up randomly so that you have 5 or 6 people in a group, and they could do their own joys and sorrows, for example, doing that. Wendy, did you have a question?
No, I wanted to say that I actually got us a deal for UUCRV through Groupon. I was able to get the Zoom for a year for like $104.
Perfect. All right.
So
Check
I
out
just want to
Groupon,
mention
everyone.
that.
Right. Right. So that's going to be some of the stuff that's going to be available. I think on this one here, there was adapting worship on Sunday mornings, for example. It's, it gives you tips on in-person gathering. What are the things you need to have in place? That you, first of all, stay home if you're sick. Sometimes we get into this, well, I'm healthier than thou kind of competition, which is not good for anyone. But this can help you to do this. And it talks about, not passing the baskets, as Amy talked about, projecting the song lyrics so you don't have to have them up there, having the orders of service in a stack so people aren't handing them to each other. And then how do you do it when people are there, and then suspending in-person worship, and how do you do that? And we are working on the resources more for that kind of thing. All right, I'm just going to close some of these windows so I can find the other ones. Yes, I want to leave the page. Thank you very much. So another site, another thing to do is to sign on to whatever your state's public health service is. So this is the one for Michigan where I live, and there's even a click here to subscribe to update button, which I loved. And I must admit, this virus is really pretty in some strange way. But then they also have, for residents, communities, healthcare professionals, all that kind of stuff. And here was the data that I was talking about. So far, they've tested 63 people as of yesterday, and they only have 39 back. So who knows? So that's another thing to be looking at. Chronicle for higher education. This was recommended in one of the in the religious professional group. They have going online in a hurry, what to do and where to start. And so it's designed, of course, for higher education, but it helps you figure out what are the kinds of things that we need to think about and look at, and how do we pull together the tips. So how and some of it won't apply, but other parts, how do you do this? I heard a report on NPR this morning where somebody from a university was saying, well, the great thing is we're having to rethink pedagogy in our classrooms. How are we doing the teaching? How can we make this exciting? And so figuring out how do you do that. And one tip that I read somewhere was that if you are having hymns, that you're singing, you make sure only one person who can sing has their audio on, and not everybody else, because with the difference in the lag time, you'll get a cacophony, but everybody could sing along at home from that, rather than with somebody leading in that fashion. Another website here is just the CDC, Center for Disease Control. Their basic page for the coronavirus. What should you know? How to, what to do when sick? All this kind of stuff. There's information for various groups. They also have, and I'll give you the direct link for this. Um, One of the problems of what happens is they have resources for community and faith-based leaders. And so there's an interim guide, there's a checklist, there's cleaning and disinfection recommendations that are just really helpful for your congregation as you're dealing with this, because once we're back to normal, what kind of cleaning should you be doing for your group? So okay. And yes, this was the email that came out to congregations from Susan Frederick Gray about what to do, and follow the local public health ordinances, do what you want to do, all these kind of things, common practices. One of the things I must say is somewhat gratifying. I've always been somewhat appalled by how many people, when they leave a restroom, a public restroom, don't wash their hands. The past week, I've not seen anyone leave the restroom without washing their hands, so that's good. Um, so I showed you this flattening the curve article, which has, a lot of things in it. What else do I have here? And then Vox had how canceled events and self-quarantine same lives in one chart. And this is another look at that flat line, flattening the curve. But they talk here about how we do this, because one of the things is that, as I said earlier, I'm more likely to be carrying this than someone else. And so how am I hurting various people who might live with somebody who's older or that kind of stuff? And it's really about the social distancing. To me, is really, and closing down things and doing that sooner rather than later, to me is very similar to why we get vaccinated. That it's that herd kind of, how do we all take care of ourselves? And so this chart, this talks more about that. And again, I'll be sending you all these. Okay, that's the faith resource one. I know I have, and then the Atlantic came out today with an article that says, oh, I only have 4 more articles, so I better keep this one open for tomorrow. But it's, you really have to cancel everything. When we look at places like China, who are now at the point where they think they're over most of it, the premier went out to Wuhan today. It's because they have done that. And this, and when we look at what Italy is doing and all of that, and I think that that's the last of the various articles I had. But yeah, it's really tough trying to figure out how do we make these decisions and how do we balance this. One of my colleagues was saying that when they were presenting this past weekend in some place, when they mentioned safety precautions, people were laughing. And when they were trying to keep things clear, people were taking it as if it wasn't a big deal. And for many of us, it might not be a big deal, but who we spread it to and how we are creating further issues is a really big thing. Yes, and Wendy asked, can we share this recorded meeting with board members? Absolutely. I was going to ask if it's okay if we put these recordings up, just common for anybody in our congregations to look at, because these really are serious things. And how do we figure this out? The Pacific Western region, where it's more the hotbed, because they're Washington State, California, all of that, they have done a couple of webinars that they are also going to be making available to people, and we'll let people know when those recordings are up. I think they're going more into the how do you do things online, which I don't have the bandwidth to really do as much with you tonight. But it's more anyway, so that's sort of my my blah, blah, for this right now. But what's still your questions? How are you struggling with this? What decisions would you like support in talking through tonight? Amy.
So I am a healthcare provider.
Mm.
And I also am a person who has a weakened immune system. And I am a person who, because of our population of our society, I lean towards standing on the edge and saying, I stand for that community, and I think that we should do our services online, and we should close our doors and just let this thing breathe a little bit and everybody get kind of situated.
Mm-hmm, mm-hmm.
And I'm getting ready to go to a board meeting tomorrow, and I'm pretty sure that I might be the only one that might say that. So it's like, I hold a little bit of a different perspective, not just because of me I'm not really afraid, because I can stay away if I want anyway.
Right.
It's not that. It's like, how do you, like we always talk about how we take a stand for those who are marginalized, right?
Mm-hmm.
And it's maybe not the popular thing to take a stand where you say, well, I think we should close our doors and let this thing breathe for a while, and let's get our footing a little bit, and let for all the reasons that you just stated.
Right.
And I just know that if I go and I say that, people are going to think I'm nuts.
Or maybe they'll be grateful that someone has said out loud what their fears are. And yeah, and if it helps, say, the UUA is the UUA is looking to cancel all their upcoming events for a while. GA is still a way out. We don't know about that, but this is serious conversation. The Ministerial Fellowship Committee, which credentials our ministers, is meeting virtually. The Religious Educator Credentialing Committee is looking at meeting virtually for their meeting. As Wendy pointed out, Pi Day, which is a program for small congregations, which was scheduled to happen this weekend. In Mid-America, we are closing up our in-person ones and directing people. There's an online version that we're directing people to.
Oh, I didn't know that.
That information is going to come out.
Okay.
And we've been asked to curtail as much of our travel as we can to make sure that we're not putting ourselves in risk. And I have a meeting I need to go to this weekend that it's a congregation that's in conflict, and there's a very key thing. But I've decided I'm driving. I'm not taking public transit, and I rent a car. There's no way I'm going to rent a car because I don't know who's been in there and how it's been cleaned before. And so it's not, and I don't fall in one of those groups, but I know I could bring something back to the people I love and care about. And if it's not so much about me, it's about protecting others and making sure that that there is enough medical stuff to go around for the people who really need it, and so that I'm not contributing to that. There's at least one UUA employee I know who is in quarantine because they were in a place where there was someone who has later been tested, so they are in quarantine. And I don't know if that contributed to closing the offices is one of the remote employees, but still, we know one person in our staff group who has to be quarantined. And so we're looking very carefully at this, and how do we, part of it for us is, do we really want to get quarantined far away from home? But in your congregations, yeah, how do we make sure that we are not inadvertently causing the harm we say we don't want to cause? So if you're having, as you said, Amy, if there's food, if there's coffee hour, things like that, you might want to, if there is worship, tell people bring your own friggin' coffee and your own treats. So how do just because I am not an alarmist, I didn't, but I take very seriously my responsibility to take care of others. So.
Amy, I do have to tell you, you're not alone as being like the lone man out. In my congregation, like I said, there's only 32 people, and this has not even been addressed, except for the vice president and myself. I have a vice president who's a germaphobe, so you can imagine this is driving her crazy. And I have a board meeting on Friday.
Right.
And that's why I was asking if I can share this.
Absolutely, and I'll get this up. I'll get this up on our channel. Hopefully tonight, and send you all the links, and then we'll make it public at some point. But yeah, and a week ago I wouldn't have been telling you to do this either. So it's just moving so quickly. That's the thing, is that they may not have been talking about it yet, but that's why I'm also providing things like the flattening the curve thing, because some of our logical, rational people, that's the kind of thing that will stir them to, oh yeah, I guess this makes sense. So that's why I'm trying to include a number of different things there. And, one of the hardest things I know that ministers are wrestling with is, what do we do about memorial services? Do we go ahead with them when they've been scheduled? Do we not do that? So.
This
Judy.
is Bev.
Oh, Bev, let's let Bev go because she's only on the phone. So Bev, go.
Yeah, I had a question about one idea I'm thinking of is just having a small number of people in the building on Sunday doing the worship. So our minister's on sabbatical. We have people scheduled to come in and preach, to have them come and preach with the worship associate, perhaps the person playing the piano for the hymns, a singer or two for the hymns, and then someone to video record it. Is that how that's usually done when you're doing a...
Sure, yes, a small group of people can work very well to do that kind of thing. Some it depends on how much you do, but you could also, it's a little harder, but you could have people in different locations on Zoom doing that as well. So the preacher could stay home, or the worship associate, and they, so you can do it either having a small group there, or do it totally virtual.
Totally virtual. Okay.
Yeah, and Zoom allows you, is you're all able to talk here. So you just, make sure everybody is muted, and whoever is the host has the ability to mute everybody, and then you can do that. And then, as I said, under Zoom, and so you'd want to get an account early this week so you could figure it out. You can also do breakout rooms so that you can divide people up into small groups to have conversation, so at the end of the service, or if there's a time during the service where you want people to be able to say hello to each other, you throw them into a breakout room for 5 minutes even, and just to be able to say hello, so that can be a way of bringing the community in even when it's virtual.
Okay, thank you. May I say something?
Sure.
I have a question.
All right, and then Judy after you. Yeah.
Oh, no, let Judy go, please, because I talk too much. Go ahead.
Oh, well, my first thing to say, Lisa, is now I'm worried because I have to get in my rental car and drive it to the airport and get in an airplane to fly back to Detroit. But if you're saying I should quarantine myself here in Sedona for a couple of weeks, I'll do that.
Well, if you need
But
a
really
permission
what my,
slip, I'll sign it. Yeah.
my question though is the information you're sharing with us, which is wonderful, is what are ministers doing as a group? Is the information you're sharing with us also congruent with what ministers are doing? Because as you know, we're a bigger congregation and we,
Right. There's information out there for ministers. Whether or not a minister is choosing to look at it, I can't, but some of this stuff is coming right off the UU Religious Professionals Facebook group. And there's other I'm sure there are other ways that people are doing. The Ministers Association also has some resources. I didn't share those with you because they're behind the firewall. They're only available to members, but your minister could also be looking there for stuff. And we will continue to sort of push things out as we find them to be able to help you all do this. But looking back though, Amy, to your question about being the only one or whatever, part of it is part of the policies to look at is how do you make the decision about dangerous roads, and then you can talk about, so what's the values behind this, how do we, and we do this because of why, and what are we trying to do, and then be able to say, to bring to the people, so how is this different? We don't know if somebody's going to crash on the road. We don't know if that's going to happen, but we make that tough decision then. And so that might be, I was just thinking that might be one way to address it, is to go back to the underlying values in the policies that you currently have around closures and apply them to this situation.
it seems also like if we communicate with our board and the congregants that it's not just about being safe, but we want to do things to sustain community and support within the congregation. So by perhaps not having a traditional service or holding hands, we still want to do things differently to sustain that spirit of community.
Right. Yes, that could be possible. And I'm just trying to pull up now. I'm going back to that professional group to pull up another slide to show you. Come on. Of course, it always, oh, there we go. I can maybe just, sometimes my internet's a little bit slower when I'm on Zoom because it takes up some of the bandwidth. But let me see if I can find this about how one community is doing with this. So the question is it just the Sunday morning, or do you have a virtual coffee hour for people when at other times during the week? And let me see if I can just find this photo to share. Here we
Wendy, I
go.
don't want to call you out, but I'm noticing you, and I do the same thing. I don't realize how often I put my hand by my mouth. And then when I'm on Zoom, I can see it and I'm like, ah.
Right. So here's what I wanted to share with you. So here's what one congregation is doing, is that they are build up our online spiritual muscles. So they're having a family time and bedtime story one night. And then they're having a lunchtime conversation where they learn about how to do Zoom. And then they're having a midweek renewal service and another lunchtime conversation. And then again on Saturday, family time and bedtime story. So that's the kind of things that don't necessarily take that much energy to do, but they're ways that you can connect with people in new ways. So I love the bedtime story. And I, would sign up to go to those, through Zoom. And the good news with the Zoom accounts, you can have up to 300 logins. Many of us don't have that many on a Sunday morning. Some of our congregations do, but 300 people on a Sunday, and you could also record it and then make it available. You should need to think about, okay, what do we do about the hymns and copyright? But these are unusual times, is what I will just say. Yeah. So that's some of the things that can be helpful.
Hey, this is Bev.
Yes, Bev.
I had the other question I had was about staff. I'm in a situation with our ministers on sabbatical, and you had mentioned a few things about staff. Do you have any resources about that?
About what kind of?
Well, and just in terms of so for example, we're a small congregation, but we have a lot of hourly staff.
Mm-hmm.
And if we're not having services or religious education and stuff, and choir practice and things like that, there's going to be a lot less work for these folks, and they don't have benefits,
Right.
like paid time off and stuff like that. And
So how might
I don't
their
know.
work shift? So the religious educator could plan those 2 or 3 bedtimes,
Story times or
story things,
something, yeah.
story times, or things like that. The music person could have a sing along, where they're playing piano or they're doing that. Of course, people would have to mute, or else it would be totally cacophony. But how could they extend their ministry through virtual means? So
Yeah.
what
Yeah.
programming could they do? Maybe there's an appreciation class of music where they play some of their favorite music for people to listen to, and people talk about it that they don't get to do on Sunday mornings. So there's all kinds of ways that they can share their gifts virtually, and
Okay.
I would also say that that for many of our people who are paid hourly or per service or whatever, uh, it then raises to me the question of justice. It's not as if you're having to pay somebody else to replace them, but by being a good, generous employer to say, hey,
absolutely,
we know that we don't usually give you these benefits, but this is the right thing to do in this case, and
exactly.
to so you can feel proud of yourselves.
Yeah. I think I have no problem with that, and I actually think our board will be quite good about that. I think as long as we don't see we actually have a fair amount of our plate donations are actually fairly high, and that's a big part of our income. We do have electronic ways for people to donate, so we'll just be reminding folks of that.
Yeah.
But yeah, as long as we don't see like a huge drop off in income, I don't foresee any problem with continuing to pay staff. But I like your ideas of that's what I was looking for, just ways to
Right.
help,
and if you have
the staff keep folks engaged.
Right, and you could even do experiments with small group ministry. Even if you don't have, if you have those, you lend out the Zoom room to each small group, but you could also just say, hey, have you ever wondered, here's how one works, and invite people to come in, and you could have, if there's a shared reading or everything, you could do that and then use breakout rooms so they can have conversations among themselves in smaller groups. So there's a whole variety of ways that we can, I mean, if this had happened 5 years ago without Zoom, I wouldn't be knowing what to say to you, but since I live every day on Zoom more than anything else, the cat's trying to break into my office. That this allows ways of coming together in new patterns, and it also can allow you ways that you might want to continue beyond this for people who are shut-ins. So
that's a
it
good
teaches
point.
you how to extend your ministry forever, not just for this crisis.
Yes, thank you.
Judy, did you have something else?
Well, I had just noticed Wendy's question, or comment about, especially older members who don't even read email, let alone use Zoom.
Hmm.
And just wondering if there might be a way to, do little one-on-one or small group to orient people to that, because I found as an instructor that once people learn how to do Zoom or check their email, especially if they have kind of a mentor or somebody helping them, they actually feel very proud, and it can really enhance their lives, because this is the way things are going. So maybe there's a way to have
Well,
people work as mentors with each other, so that if you do decide to go with the Zoom, people feel individually supported in that.
right. So what you might do is you might have a group of younger people who will do this, but who could go and teach people how to do that in their homes. I want to share one other thing that now that I've discovered where to find it. Oh, come on, where's my um, here we go. So Zoom itself has tutorials. So you can send people to this and how to join a meeting, how to schedule a meeting, that kind of stuff, how to join a meeting. And so they teach you how to do it. Now you have to be able to be on the web for this, but you might be able to send people a postcard and say, hey, go online to this, because we still have mail delivery for the moment. But it also talks about how do you join a meeting by phone, if you see over here on the left. And so this is something that can really help people learn how to use this tool, just as one other practical thing. And I will grab that page to put in the list of resources as well. Yeah, and you saw on that thing I showed you where they were having small lunch gatherings at the church so people could learn how to do that. So you could do that as well, the one-on-one or a small gathering. Most what they usually say is no more than 10 people, and you can still be some distance apart, and be very careful about how you're doing things, but that might be a way to help with that as well. Anything else, or is it time for the closing reading? Okay. The thing to remember is this is going to change. And the skills that we learn now will help us figure out other ways to develop community and include more people who have mobility issues or age issues or are sick or parents with small kids so they can't get there. There are all kinds of things that we can learn during this time that will help us. But it also takes a lot of courage. And this is one of my favorite poems about courage. It's by Anne Sexton, and so I'm going to use it to close. It's in the small things we see it. The child's first step, as awesome as an earthquake. The first time you rode your bike wallowing up the sidewalk. The first spanking when your heart went on a journey all alone. When they called you crybaby or poor or fatty or crazy and made you into an alien, you drank their acid and concealed it. Later, if you faced the death of bombs and bullets, you did not do it without a banner. You did not do it with a banner. You did it only with a hat to cover your heart. You did not fondle the weakness inside you, though it was there. Your courage was a small coal that you kept swallowing. If your buddy saved you and died himself in so doing, then his courage was not courage. It was love. Love as simple as shaving soap. Later, if you have endured a great despair, then you did it alone, getting a transfusion from the fire, picking the scabs off your heart, then wringing it out like a sock. Next, my kinsman, you powdered your sorrow, you gave it a back rub, and then you covered it with a blanket. And after it had slept a while, it woke to the wings of roses and was transformed. Later, when you face old age and its natural conclusion, your courage will still be shown in the little ways. Each spring will be a sword you'll sharpen. Those you love will live in a fever of love, and you'll bargain with the calendar. And at the last moment, when death opens the back door, you'll put on your carpet slippers and stride out. So your leadership in your congregations is not a little thing, but what's visible to the other members may only be a bit of the courage that you exhibit in helping your congregation wrestle with the difficult challenges like we're faced right now. So I want to thank you again, as I do each month, for what you do for your congregations and for our faith, and know that we here in Mid-America are here to help you in whatever ways we can. And so with that, I will bid you all good night.